The symptoms of anxiety are overwhelming worry, which is quite out of proportion to the situation. Sometimes there are physical symptoms, for example, the heart beating very fast, feeling short of breath, tense muscles, or tingling in the fingers, for example. Panic disorder is when the anxiety comes on very acutely and it's extremely unpleasant. The symptoms can be so severe that the person thinks they're going to die. Their heart is pounding, they may be very dizzy. Sometimes it's so bad the person then tries to avoid the place where the panic happens. The advice I'd give to junior staff is to be very understanding with these patients because they may feel that their symptoms are silly. So it's very important to help the patient to understand that you're taking their symptoms seriously, that you're listening to them very carefully so that the patient feels understood. How much of a problem are benzodiazepines for the GP? Well, the answer is quite a problem because the authorities and the guidelines tell the GPs nobody should be on long-term benzodiazepines. But the patients may be very vociferous, demanding long-term benzodiazepines, and quite honestly, every GP has a small number of people who are on long-term benzodiazepines, and unfortunately, that's life.
If I could say one thing, it's the most lonely thing in the world in fact, it makes me quite tearful to come off of tranquilizers like I did. To come off of, I've never taken other drugs, so I can't say, but it's very lonely. And on the surface, you look very well, but inside, it's very difficult. Anxiety, panic, extreme, to the point where everything I did required taking a tablet to go to a party, to go to dinner, to go out, to socialize, to mix, to go from A to B. I took a tranquilizer to be able to do it. So then there was depression. I was told I had depression rather than was aware of it. Of course, I became aware of it because I took an overdose, so that means depression. You don't do that. And then troubles with my relationship. If I think about it, I think relationships for me alter my mood. So I think that has to go in there. It's not blaming the other party. It's very complex to go into, but I tended to be taken over by the other person and lose myself, and that gave me anxiety as well. Fear of not being a good mother. I use the word damage because I'm a layman, but it's very sensitive, oversensitive. So something might happen and immediately it's like that angst in the body, but I've learnt now that it's a feeling. I mean, it sounds a bit trite, but and it will go away. But I have longings occasionally to take a tranquilizer. I've had access to them, my parents have them, for various reasons. I have no compulsion to take one, but it's the feeling of, the feeling they give you. It's a very nice feeling.
Why do you think that you've been brought into hospital this time?
Because I can't take care of myself. because I don't know how it happened actually, but the last 4 months I was taking too many tranquilizers. And Dr. Macaulay, I didn't really have any choice. I was staying with my sister and my ex-partner, and then I couldn't be alone, so Dr. Macaulay said I could come in hospital if I stopped taking flurazepam, and they made up the difference, sort of, with the diazepam, but it's not the same, and it's a vicious circle because I'm agoraphobic, and I'm just in fear all the time, and when I take lorazepam, I don't feel like that.
Do you remember how much you were taking? What was the maximum amount you were taking?
That was too much. It was 13 milligrams a day.
Okay.
But I learned the lesson that it's too much.
What things were you having trouble doing? Like, were you able to shop for yourself and go to the grocery store?
Much better than now.
Better now?
Much better than now.
Oh, much better than now. Okay, so you find things harder now?
Without the lorazepam, yeah.
Okay. So you said you're having trouble at home, though, taking care of yourself or being alone? Is that right?
Yeah.
And how about now?
It's worse.
It's a little worse. And how about switching your medication? How's that making you feel? Do you feel that it's making a difference, or?
I feel, in a way, I'm taking sweets.
No effect?
Doesn't feel, but I feel I need them because I feel that they should have lowered it together slowly.
Okay.
And I want to ask Dr. Mahmood if he'll do that, but I don't think he'll change his mind.
What do you mean by when you say you have agoraphobia? What does that mean to you?
Fear of going out. I've got claustrophobia, and I've got social phobia. I always had it,
Okay.
but suddenly I got agoraphobia as well.
Okay. So only that medication was making you able to go outside and do your things before. Okay. So, do you think that you need to be in hospital right now?
Well, I can't look after myself.
You can't.
But I would like to go back on lorazepam and diazepam and lower it slowly. I think would be much more beneficial for me. And then I would be able to go for walks and do my classes. And
what type of symptoms do you get when you start to go out in a new place or a public place? What do you start to feel?
Panic and fear, and I just can't do it.
You can't do it. So do you always try to avoid going to places like that? Okay. So does that mean you spend a lot of time inside your house, inside your home?
Well, it got worse since I got here and they took the lorazepam away. I would go out a bit.
But now, you don't want to go out?
No, I'm a wreck.
And do you feel these symptoms are due to the medication not being there, or
Yes.
something else?
No, it's definitely the medication.
Okay. All right.
It's psychological, of course.
Mm-hmm.
Everything is. Fear is, everything is. But I took it for such a long time.
All right. How long were you
And
taking
it works. It works for me. I don't know why.
How long have you been taking it?
Half my life.
Half your life. Okay. Do you want to not be on it anymore? Do you see a day where you're no longer need those medications? Do you want to?
I think that I can go out tomorrow and be run over by a bus. So I don't see the point
You
to
don't.
go through all this agony.
And I've been, if I look back 6 months, that is a very good measure of the progress, as opposed to me looking back to last week or yesterday or whatever. For instance, yesterday, I drive my car all the time now. I have to exchange it this weekend, and the new one's like a pilot's computer thing. There's no, what do you call it, clutch thing. It's all up here, so I'm going to have to practice a bit. I'm a bit nervous about that. It doesn't take much to trigger my nerves for me to keep them at a certain level, which I'm trying to manage to do. And I'm going to Windsor, I do this mantra while I go and have a cappuccino. I talk to myself because I'm in a constant panic all the time, but the only way to get rid of it is to keep doing it, keep doing it, keep doing it. I get tired. I don't allow myself to sleep in bed, but if I'm up and I want a nap, I take it. Sometimes a weekend I get up a bit later. My medication, yes, I could do with more tranquilizers, but I have not taken one, not even a half of an extra tablet. I've been thinking about things that happen, and my best friend, I think I told you, Pamela, she was like my sister. She died in the aeroplane, and when I was 20, 21, and I never really grieved over that at all. My other best girlfriend, she died a couple of years ago, and in my mind I think this is my punishment. They died, and this is what I'm having. It's weird, but I think of that sometimes. And I think of Pamela and the fact that they only found her red boot in the mountains. And I never used to think about those rapes and things. And I don't know if there's a connection to this illness or whether you go into that in therapy, whether it's best left. I don't know anything about that. I just know that I've got a lot of fight in front of me, a lot of, I'm not anywhere near there yet, but I know that I have a lot to offer if I think about it as a third person. I'm intelligent, I'm talented, I get on very, very well with people usually. Well, I was not very academic at school, hated school. I was fat, 5'4", 3, and weighed about, I don't know, 4 stone more than I should, so in kilos that's a lot, and teased, etc. So I left school when I was 15, which you're allowed to do then, no qualification. And my mum got me a job with the chemist in Hornchurch where I lived. And it was a completely different world. Nobody teased me, nobody called me names, etc. And within 9 months, the owner, the guy who ran it, the pharmacist, wanted to send me to college to learn to become a pharmacist, because he saw these things in me. And he wanted me to manage the shop. And this is just before I was 16. But then I saw an ad, going back to your question, in the Evening Standard saying people wanted for extras in, and I've always acted at school, albeit the fat part, but I always acted. And I answered it, and it turned out to be a modelling academy called the London Academy of Modelling. This is one of my favourite pictures of when I was 16. I love it. I think you always have your favourite. So to go from working in the chemist to the Bahamas, this was like in the same year, which is what my dad freaked out about. This is Revlon, that's Charlie, and I was the Charlie girl in South America. Apart from this one, which was a Japanese Vogue, these are all pictures in a magazine called Claudia, which is, again, like Elle, Marie Claire, it's a ladies' magazine. I always say I'm lucky, but I guess beyond the luck is right face, right time. And I was a bit behind Twiggy, about 2 years behind her. And it was that type of look that was popular at the time. And it went on from there. And I went to New York. I've been all over the world, really, with it. It's very difficult to say when, but everything was fine until I had a girlfriend called Pamela. She was like my sister. And we were very close, etc., etc. I was 21 at this point, and she died in a plane crash. I think that was a big turning point for me. I spent 6 weeks with her parents. It was a very, very, very difficult time for all of us. And then I went to Switzerland to work. I just took off. And I met my first husband. And retrospect is a wonderful thing, but who I married and had a child very young. Well, young for me, because mentally, relationship-wise, I was very naive. I guess anxiety, but I didn't know what that was. So I didn't speak Portuguese at the time. Walter was looking for a house for us. We were staying with German friends of his. And at the time I didn't speak German either. So I was really on my own, diagnosed as being borderline to go into hospital with anemia. And it was 44 degrees heat. We went at Christmas from snow. And I remember they call them baratas, they're cockroaches, and they were flying over the beds at night when you slept. They're flying cockroaches, and it's my one memory of going into panic. And that triggered me over the edge. And when after Zora was born, Walter didn't like to come to hospitals, so basically I was on my own. In this hospital, my gynecologist said I had to have a cesarean because I couldn't give birth naturally. All I wanted was my mum, really. What I should have had was therapy, possibly antidepressants. In my wisdom now, through knowing and meeting you and the last 30 years, that's what should have happened. But I was given diazepam. Albeit, when I stopped it, I was taking over 100 milligrams a day, a huge, life-threatening amount. Then, for years, I took 10 milligrams, 15 milligrams, and lived a perfectly normal life, but never dealing with anything. Never. I'd just take another pill, and that's when it started. And I was quite suicidal then, and like a stick insect. And anyway, my mum came to New York and brought me home, and I was sedated to come home. And then I found my GP, where I went to live with my parents, and my GP recommended a psychiatrist in Bournemouth. That was my first real, with Dr. Roten Lee. And he put me on medication. And within a year I was running my business. And we were called Van Cleef Knitwear. And we won, I was invited to go to Vienna by Princess Diana, God bless her. Anyway, and these clothes that you see here, this one and those, are in the Victoria and Albert Museum in London in the permanent collection, because I invented a new way of using hand knit to tailor as a tailored garment. So I'm just blowing my own trumpet.
People do get angry. They're angry because they don't know how this happened to me. And they remember who I was. And I was a leader, and I was the president of a big company, and I was a lot of things that people admire. And now they don't know how to deal with me. I mean, the fact that I have fought for 5 years through this illness, which I think is admirable. I don't know if you agree, because I've fought this illness. They don't find admirable. It makes them angry. And I don't need to defend my position. I'm intelligent enough to know that. So I isolated myself, and the isolation caused the depression to worsen, probably. Because becoming a recluse is good in one way, because I don't have to deal with all this potential problem of myself towards others. But in the other way, there's only so much reading and education and intellectual pursuit and other things that you can do before you turn in on yourself. And some, not fear, funny enough, I'm not afraid. I'm just empty, hopeless.
And then life went on, life went on. I met my son's father and fell in love and got pregnant again. And at this point, Dr. Rotenlee did tell me he didn't think it was a great idea to have another baby, because he associated Zora's birth with the root of everything. But I went ahead and I had another breakdown, really. Not a breakdown as such, but after Luke was born I had postnatal depression. And then I started to see I was put in touch in this area, because this was in Windsor, because before with my knitter I was in Bournemouth. So when I came up here, that's when I first met you, when Luke was very young. And that's really, long story cut short, I think then it would be, he's 21 now, so. Initially for me the medication helped very well. 35 years ago I got a life back, etc. It wasn't a long-term thing, certainly not, as I've said, tranquilizers. So I think therapy, antidepressants, and if you're very lucky to have a good doctor, that's key. So you're not just given pills like sweet, and you need someone, much like you were with me, you were always very kind, but you were very firm. And if I did something wrong, you told me. It wasn't sugar-coated, but it wasn't cold. So I felt secure because there was a boundary. I felt that you were helping, in control, and how can I say? A huge reassurance for me.
There are no perfect treatments for anxiety. All of them have problems. All of them will work in one person but not in another. Usually the first line of treatment is a trial of selective serotonin reuptake inhibitors. The problem with this group of antidepressant drugs is that sometimes people feel more anxious at first before any effects are felt on the anxiety or depression, if there is depression. What are the differences between anxiety and depression? Nearly everybody who is depressed is anxious, but not everybody who is anxious is depressed. The things to look for in depression are mood varying with the time of day, often worse in the morning, poor sleep, for example, waking up in the middle of the night, not being able to enjoy anything, and feeling low most or all of the time. Generally speaking, yes, if the anxiety is bad enough, even though the patient may say, I'm not feeling depressed, but it's thought to work on the same brain chemicals. The first line of treatment is generally an SSRI, selective serotonin reuptake inhibitor. If the first-line antidepressants, selective serotonin reuptake inhibitors, are not working or are causing too much anxiety or other side effects, it's worth trying a second-line antidepressant. At the moment there are two main ones, mirtazapine and venlafaxine. Mirtazapine is good because it can help the person to get to sleep, but on the other hand some patients gain a great deal of weight on it, which of course can make the patients more anxious and more depressed, which is exactly what you don't want. The other antidepressant that's worth considering is venlafaxine. Again, there are some patients who gain weight on it, but the main problem is withdrawal problems, that some patients can feel very sick or dizzy when they're trying to reduce the dose or stop the medication. Psychotherapy has a place for some people because it's very helpful for some people to talk through their problems with an outside person. What the GPs are very keen on at the moment is cognitive behaviour therapy. It can help some people, but people have to be able to cooperate with it, and that doesn't apply to everybody, especially not those that are very ill.
It interferes with everything. You can't live your life normally. You can't enjoy my children as I would like to. Watching my son run around in the park, you know, I just wanted to go home. I hate being surrounded by people. It's horrible, and I've got that miserable that I just can't put up with it anymore. So I thought, well, I just have to try something. There must be something somewhere that suits me. And I think that the Valium that I've been given has been immensely helpful. The anxiety for me is the anxiety about my health and about my children's health. The anxiety affects me. Like I said, I hate being around lots of people. Apart from being depressed, by that I mean horrible sinking feeling that you have all the time. Feelings of being inadequate, failing at everything, being an inadequate mother, very low self-esteem it comes from. Physically, I have frequent migraines, I get dizzy. The other way it affects me is my temper's quite foul, and the mood swings are quite shocking. I can go from being quite mellow, I'd say, in a really happy mood, you know. I don't have highs, I don't have highs at all, but I can be in a quite happy mood and enjoying myself, and then the slightest little thing or comment from someone will just plummet me into this depression or this real bad temper, you know, where you feel really aggressive, you know. And I have been quite argumentative in public, which is very embarrassing when you're a 37-year-old woman married with children. You know, it's not the adult way to behave, but it's uncontrollable when it starts. It's like a real rage. I did not want to kill myself, but it's the unbearable feeling of feeling so awful and not knowing what other way there is. It's like being in a great big black hole and you're never going to get out of it, you know. And sometimes, you know, you can be driving along. It doesn't happen now, but when I was at my worst a couple of weeks ago, you know, you could be driving along and all of a sudden you think, now, all I've got to do is just turn this wheel a bit to the side and I'll go off the road and that's it. And I don't know if it's a compulsion or not, but it's a frightening thought to have, because it's not a rational thought, and it's amazing how you can sort of lose it enough to want to behave in that way, you know, to want to actually do that. It's such a desperate thing to do, and really I think it's just a feeling of not knowing what else to do.
Ten years ago I was a pretty miserable person, no self-confidence, really flat, no enthusiasm for life, not suicidal but couldn't enjoy anything at all. I was taking Effexor and Valium to start with, and in the beginning they worked, and the Effexor was quite easy to come off after about 9 months. I think that it got me out of the doldrums quite a bit, and the Valium helped with panic attacks. But what I came to do was, without even realising it, rely on diazepam, and got into a bit of a vicious cycle with it. My doctor was extremely nice and extremely helpful, and the agreement was to reduce me by something that I was comfortable with. So there was absolutely no pressure to say, right, you know, every week you're going down by this amount, but at the same time I had a goal. I set myself a goal as well. Really the power was kind of handed over to me in a way, which was really important, because I'd had 13, 14 years of not being actually in control, because I had a very unhappy marriage as well. And actually having that control and doing it for myself proved to be one of the most important things that's happened to me in the past 10 years. It seems like a very little thing, but it's actually very important.
These morbid thoughts only started when I lost my baby, because seeing your baby dead, you know, you're supposed to hear your baby cry when it's born, and of course there was no sound when my baby was born, and seeing a dead baby, it's indescribable. You know, your hopes and dreams end right there, and I've never been able to erase that memory. You know, that I quite often go back to it. It sounds really awful, but I'll quite often, if I'm awake at night, this is what happens. I wake up and I start kind of reliving what happened, and I'll picture the baby dead, the baby girl that I had, and it was a horrible sight. And since then, that's when I've had these morbid thoughts, and I'm always imagining something awful happening to the children. He finds it hard to accept that his wife is not, you know, like his brother's wife, like his sister. You know, they just seem to plod on and cope, and what's gone wrong with me? Why can't I cope? He tries to be supportive, and he's very caring, but he's not very good at it, to be honest, because, you know, I think he's kind of refusing to acknowledge that it's happening, that it's a real illness, and it puts quite a lot of pressure on me.
I think there were several contributing factors to my depression. I was in an unhappy marriage. I'd lost a baby. I think there's several life events that I hadn't probably dealt with very well. But on the other hand, at that time I wasn't taking responsibility for my own part in anything at all. I was just constantly blaming everyone else for my problems. So it becomes quite a self-destructive pattern. Yeah. I don't think it's something you ever get over. I think it's something that you learn to live with. It's like any major, horrible life event. Part of that is realising that I'm not the only person. I know that's very personal to me, but I'm not the only person that's been through that experience. And almost everyone you meet has been through a horrible life event. And I think the tendency back then was for me to think of only me. It's still a painful thing to think about, but I think I see it slightly differently now. It's an event that happened in my life. I got through it. I probably am somewhat stronger because of it. You know, we survived it as a family. Yes, I'm divorced, but my children and I survived it. It's just one of those horrible life events. I think that the key is perspective, and that's the thing that I never used to have, and now I have that. The marriage wasn't solid to start with, so losing the baby just made things, I think, a lot worse, and my ex-husband didn't perhaps cope with it in the way, I don't want to say cope with it in the wrong way, because I'm not in his head, but I don't think he dealt with it in the best way he could have. So, and neither did his family. And you know what, to an extent, neither did my family. Now I look back and I can see faults everywhere in myself too. So I think that, yeah, I don't think it helped. I think that the doctor had a lot of belief in me, and it took a long time for me to see that. It took a long time for me to see it, but that helped me so much, so much. It helped me get a lot of, helped me gain perspective, helped me to see that I wasn't a failure, helped me to see that I could do things with my life, helped me to see that I'm capable. And sometimes, I think sometimes you need to hit a real low, and I also hit a real low point with the diazepam. I hit an incredible low, and I don't think I could have got much lower. And that was the turning point for me then, I think. And then with the support that I've had from my doctor, it's incredible. Everything's turned around. That's it. And now we need 200 mils of water. Or we guess it. We guess it, and we mix it and think, well, that looks okay. That's the way Mummy does it.
Okay.
Did you want pink or blue? Pink or blue?
Know.
I think most people probably can get better with the right care, with the right understanding. It takes a lot of understanding, because I look back at the person I was and I have no idea how my doctor dealt with me, because I was incredibly frustrating. In fact, now I can see things. It sounds almost like I'm being judgmental. I'm not. It's just that now I have a different perspective. I can always be irritated when I see things in other people that I was doing myself. And everyone can get better, I'm sure of it. I'm sure of it. With the right care, everyone can get better. I'm sitting here today, I am proof that you can get better.
My goodness, anxiety is very difficult to treat. The medications have side effects, they often don't work. Cognitive therapy, behaviour therapy is not suitable for everybody. You may be supporting an anxious patient for literally years. Do psychiatric patients get better? Of course they do. And when they do, it's marvellous. The change is so dramatic, it's absolutely wonderful to see it.